Hello and welcome again. This is your host Harshit Sinha continuing the topic on the most demanding and challenging waste management aspect is related to biomedical waste in our country. Biomedical waste refers to any waste that is generated during the diagnosis, treatment, or immunization of human or animals. Biomedical waste in India has seen significant change in the recent years, particularly during the COVID 19 pandemic. In 2022, the country generated approximately 705 tons per day of biomedical waste with about 645 tons per day treated using available facilities. This includes a variety of waste types such as discarded medicine, syringe, bandage, infected blood, human tissues, and more. Proper management of biomedical waste is critical because it poses a severe threat to public health and environment if not handled, stored, and disposed of appropriately. During the pandemic, there was a notably increase in the biomedical waste generation. In 2020, India produces an average of 774 tons per day, peaking at 1614 tons per day on a certain days, with 60% attributed to the COVID 19 waste. Despite a combined treatment capacity of 1590 tons per day, challenges persist. Some states lack adequate common medical waste treatment facilities, leading to resilience on captive treatment methods and deep pit burial. The Central Pollution Control Board has implemented guidelines to manage biomedical waste effectively. However, gap between waste generation and the treatment remain, necessitating enhanced infrastructure and compliance to ensure safe disposal and mitigate environmental public health risk. This presentation explores the status of biomedical waste management in India, quantifies different types of biomedical waste produced, and delve into the issues and challenges India faces in managing biomedical waste effectively till 2024. Quantifying biomedical waste types in India is essential for understanding the scale of waste management challenges. Biomedical waste primarily consists of infectious waste, sharps, pharmaceutical waste, and radioactive waste, each requiring a specific handling and disposal method. First, infectious waste accounts 50%, including items contaminated with the blood, body fluids, and discarded materials from healthcare facilities, forms a major portion of biomedical waste. It contributes significantly to approximately 705 tons per day of biomedical waste generated in India as of 2022 according to CPCB. The second is related with the sharp waste that accounts around 5%, such as needles, syringe, and scalps, poses a high risk of injuries and disease transmission. Effective segregation and treatment system, including autoclaving and shredding, are essential to manage this category safely. Third is related to the pharmaceutical waste, contributes only 3%. Compromise, expired or unused medications contribute a smaller fraction but present significant environmental hazard if not disposed of properly. It requires specialized incinerators or secure landfilling. The fourth and the last one is related with the radioactive waste, which has the lowest 1% that is being generated from diagnostic therapeutic procedure through a minor component demanding highly regulated storage and disposal to prevent radiation hazard. However, combining all these four, it accounts to 24% only. The remaining 76% consists of general waste, which is similar to the domestic waste but requires proper segregation to prevent contamination. This percentage can vary based on the type of healthcare facility and service provided. Despite a national treatment capacity of 1590 tons per day gaps in biomedical waste management, infrastructure remains highlighting the need for a comprehensive, compliance, and upgraded infrastructure. This slide shares the experience of the impact of COVID 19 on the biomedical waste. The COVID 19 pandemic had a profound impact on the biomedical waste management in India, significantly altering the waste generation pattern and management strategy. The first one is related to increased waste generation. The surge in healthcare activities led to a sharp rise in biomedical waste production. During the peak of pandemic in 2020, India generated on an average 774 tons per day of biomedical waste with a peak of 1,614 tons per day. Much of the COVID-19 related waste including masks, gloves and personal protective equipment. The second is related to new waste stream. The pandemic introduced unique waste streams such as contaminated disposal masks, waste shield and disinfectant containers. This poses a new challenges for the segregation, collection and treatment. The third is related with the strain on existing infrastructure. Despite India's treatment capacity of 1,519 tons per day, many common biomedical waste treatment facilities were overwhelmed. Some regions restored to deep burial and captive treatment methods, raising concern about the environmental and health impact. The fourth one is the most important one that made the authority to revise guidelines. The Central Pollution Control Board issued updated guidelines to manage COVID-19 biomedical waste safety, emphasizing separate collection, double-layered bags, and disinfection protocols to prevent infection spread. Strengthening compliance with these guidelines remained critical for effective biomedical waste management in post-endemic era. The evaluation of biomedical waste management guidelines in India reflects the country's growing focus on the environmental sustainability and public health. Over the years, regulatory framework have been strengthened to address increasing waste volume and technological advancement in treatment and disposal. The first and the early framework came in 1998. The first comprehensive biomedical waste and handling rules in 1998 introduced under the Environmental Protect Act of 1986 mandate segregation, collection, treatment and disposal of biomedical waste. It defined biomedical waste category, disposal methods and responsibilities of the healthcare facilities. The second is related to the revised rule of 2016. In the response to the growing challenges of biomedical waste, rules 2016 were implemented. These rules streamlined biomedical waste categories from 10 to 4, emphasizes mandatory pre-treatment of the laboratory's microbiological waste and introduced barcoding and GPS tracking system to monitor waste movement. They also broadened the scope to include vaccination camps, blood donation drives and surgical camp. The other is related with the amendment of 2018 and 2019. Subsequently, amendment strengthened the compliance. The 2018 revision mandates the phasing out the chlorinated plastic bags and gloves by 2019 and strict monitor of common biomedical waste treatment facilities. The 2019 amendment further emphasized occupier responsibilities and expanded guidelines for deep burial practice in rural area. Continuing from this, the COVID-19 guidelines that is in the era of 2020 and 2022, the pandemic necessitated additional protocol for COVID-19 waste including double-layered bags, labeled containers and separate storage and treatment pathways of infected waste. The Central Pollution Control Board (CPCB) issued periodic updates to ensure safe handling of pandemic waste. The continuous evaluation highlights India's commitment to improving biomedical waste management through a better technology, robust regulations, enhanced compliance framework. The evolving regulatory framework aims to address the changing landscape of healthcare and waste management technology. However, effective implementation remains a challenge across the country. After guideline, let us now explain the meaningful meaning of color coding system for biomedical waste segregation. The color coding system for biomedical waste segregation in India plays a critical role and ensure proper handling, treatment and disposal to minimize the environmental and health risk. Introduced under the Biomedical Waste Management Rule of 2016, this system mandates specific color code containers and bags for different waste types. The first is yellow category. This category is designated for infectious and pathological waste, including human and animal entomophysical waste, soiled waste, expired medicine, and chemical waste items like contaminated dressing, body fluids, soaked cotton, and microbiological lab waste must be discarded in yellow bag. Treatment includes incinerator or deep burial. Yellow colored container ensure the destruction of potentially infectious waste to prevent disease transmission. The next is related with the red category. The red bags are used for the contaminated recyclable waste such as intravenous tubers, catheters, and syringe without needle. This waste is treated using autoclaving, microwaving, or chemical disinfection before recycling. Red containers helps segregate plastics and rubber items that can be safely recycled after treatment. The next category is related with the white translucent category. White puncture-proof containers are designated for sharp waste including needles, scalps, and broken glasses. This category requires specialized handling to prevent injuries. Treated sharp are shredders or encapsulated to eliminate hazard. The last one is related with the blue category. Blue containers are used for the glassware and the metallic body implants. This includes broken ampoules, glass vials, and metallic implants, which are disinfected or autoclaved before recycling. Proper segregation in blue bin facilitates safe processing of non-infectious metallic and the glass waste. Overall, the color coding system improves efficiency in waste management and ensure regulatory compliance, consistent adherence, reduces the risk of cross-contamination, protect healthcare workers, and support sustainable waste treatment and disposal practice. Now, this slide discusses about the treatment technologies for biomedical waste. The biomedical waste treatment technology in India are governed by the Biomedical Waste Management Rule 2016, ensuring environmentally sound and the safe disposal. The common treatment methods include incinerator, autoclaving, microwaving, shredding, and the chemical disinfection. These technologies are implemented in common biomedical waste treatment facilities which handle waste for the healthcare establishment. The first one is related to the incineration. Incineration is widely used for treating yellow category waste including human and the animal entomophysical waste, soiled waste, and expired pharmaceuticals. The process involves burning waste at a high temperature, nearly 850 degrees centigrade or even higher, to reduce it to ashes, eliminate pathogens, and reduce waste volume. Incineration is suitable for hazardous, non-recyclable biomedical waste but must meet emission control standard to minimizing air pollution. The next is related to the autoclaving. Autoclaving is a cost-effective and environmentally friendly treatment for red, white, and blue category waste. It uses pressurized steam at a temperature between 121 degree centigrade, that is 121 degrees centigrade, to 135 degrees centigrade to sterilize waste, make it safe for disposal or recycling. Autoclaves are preferred for treating infection waste, sharp and laboratory waste. Next is related to microwaving. Microwave treatment use electromagnetic waves to heat and disinfect biomedical waste. It is suitable for treating most biomedical waste except the cytotoxic drugs and chemical waste. Microwaving effectively neutralizes the pathogens while reducing the waste volume, making it sustainable option. The fourth one is related to the chemical disinfection. Chemical disinfection is used for treating liquid biomedical waste and certain types of solid waste. It involves using chemical like sodium hydrochloride to destroy pathogen. This method is commonly applied in healthcare facilities for laboratories and the surface disinfection. The next is related with the shredding. The shredding is a supplementary treatment used after autoclaving or a chemical disinfection. It physically reduces the size and the treated waste, making it unrecognizable and preventing reuse. Sharp and the plastic are often shredded before final disposal. And the last one, the sixth one, is related to the deep burial. In rural and the remote areas where advanced treatment technologies are unavailable, deep burial is permitted for certain yellow category waste. However, strict guidelines regulate this practice to prevent soil and the groundwater contamination. India's growing healthcare sector requires scaling up the treatment infrastructure, ensuring regulatory compliance and adopting advanced technology to manage increasing biomedical waste volumes effectively. Continuous monitoring by the Central Pollution Control Board is crucial to ensure the sustainable practices. Now, since we have discussed about the processing technology of biomedical waste, let us now explore the role of stakeholders in the biomedical waste management. The management of biomedical waste in India involves multiple stakeholders, each playing a critical role in ensuring safe disposal and compliance with the regulatory standard. Coordinated efforts by the healthcare facilities, treatment plants, regulatory bodies, and the training institutions are essential for effective biomedical waste management. The first is related with the healthcare centers. Hospital, clinic, diagnostic labs, and the research institutions generate biomedical waste and are responsible for its segregation at source according to the color code guidelines. Proper segregation reduces the risk of the cross-contamination and ensures efficient treatment. Healthcare facilities must also ensure that biomedical waste safely stored, labeled, and handed over to the authorized treatment facilities. The second one is related with the common biomedical waste treatment. These facilities collect, transport, treat, and dispose of biomedical waste. They use this technology like incineration, autoclaving, and shredding to ensure safe treatment. Proper functioning of common biomedical waste treatment facilities is crucial to avoid environmental hazards and maintain public health standard. The next is related with the regulatory bodies. The Central Pollution Control Board along the State Pollution Control Board monitors compliance with biomedical waste rules. They issue guidance, conduct inspection, and ensure penalties for non-compliance. Regulatory oversight ensures safe handling, treatment, and disposal of biomedical waste. And the last one is related with the training institutions. Educational and the training institution provides specialized course on the waste management practice and safety protocol. Continuous capacity building helps healthcare workers and facility managers stay updated on evolving regulations and technology. In this regard, collaboration among these stakeholders is vital to achieve sustainable biomedical waste management, protecting both the environmental and the public health. In conclusion, one can say that for an effective biomedical waste management requires a coordinated effort from all stakeholders. Each plays a crucial role in ensuring the safety, healthcare workers and patients and the related concerned environment. Now let us discuss what are the challenges in biomedical waste management. Biomedical waste management in India focuses on the significant challenges despite evolving regulations and the growing infrastructure. These challenges affect efficiency and the safety of waste disposal, posing risks to public health and the concerned environment. First is related with the inadequate infrastructure. Although India has over 200 common biomedical waste treatment facilities, many regions, especially rural areas, lack adequate treatment and disposal facilities, especially linked with a smaller town. This leads to improper waste handling and open dumping. The second is related with the poor segregation. Segregation at source is a critical step in biomedical waste management. However, many healthcare facilities fail to properly segregate waste according to color code guidelines, leading to cross-contamination and inefficient treatment. The next is related with the limited awareness. Lack of awareness among the healthcare workers and ancillary staff about the risk of improper biomedical waste handling exacerbate the problems. Insufficient training contribute to unsafe practice and occupational hazard. The next is related with technological gaps. While the technology like incineration, autoclaving and microwaving are available, many facilities use outdated or poorly maintained equipment, reducing the treatment efficiency. Access to newer environmental sustainable technology remains limited and mostly cornered to the urban areas. The next is related to concern of regulatory enforcement. The Central Pollution Control Board and the State Pollution Control Board monitor compliance, but enforcement of biomedical waste management rule is inconsistent all over India. Many facilities operate without adhering to prescribed standards, leading to non-compliance and environmental pollution. Overall, addressing these challenges requires a strengthening infrastructure, promoting awareness, investing in advanced technology, and enforcing stricter regulatory compliance to ensure sustainable biomedical waste management. These challenges form a complex web of issues that needs to be addressed simultaneously to improve the overall biomedical waste management scenario of our country. We have discussed the challenges of biomedical waste management in India. Now let us explore the economic aspect of biomedical waste management. The economic aspect of biomedical waste management in India are significant, involving investment in infrastructure, operational expense, and opportunities for revenue generation. Proper financial planning and sustainable model are crucial to meet the increasing demand for effective waste management system. It starts with investment requirement. Establishing a common biomedical waste treatment facilities requires substantial initial capital for acquiring land, setting up treatment technology related to either incinerator, autoclaves or shredder, and ensuring compliance with the environmental standard. Government incentives and private sector participation are vital for funding infrastructure expansion in under-reserved area. The second is related with the operational costs. Running a biomedical facility incurs recurring costs, including transportation of waste from healthcare facilities, energy consumption for treatment process, labor wages, maintenance of equipment, and compliance monitoring. Transportation and disposal fees are often charged to the healthcare facilities providers, reflecting the facility cost structure. Rising energy price and the need for the modern technology increase operational expenses. And the last one is concerned with the revenue generation. Despite high costs, biomedical waste management offers revenue potential. Recyclable materials such as disinfected plastic and glass can be sold to authorized recyclers, Efficient waste treatment can reduce operational cost and generate carbon credit under the sustainability initiative. Public-private partnership and investment in advanced technology also create economies of opportunities. Balancing costs with the revenue and promoting efficient, sustainable biomedical waste management system requires policy support, financial incentives, and innovation in recycling and energy recovery, making the sector economically viable and environmentally responsible. Now let us explore the international best practices in some countries and compare with what is the position of India in this regard. Several countries have established robust systems for biomedical waste management, demonstrating innovative and sustainable approach to waste handling and disposal. The first country is Sweden. Sweden prioritizes waste immunization through stringent regulations and advanced recycling technologies. Healthcare facilities focus on source reduction by using reusable materials and efficient procurement. Incineration with the energy recovery is a key treatment method ensuring minimal landfill waste. Strict enforcement and the public awareness campaigning further enhance the compliance. The next country in this regard is Japan. Japan adopts a meticulously technology-driven approach. Biomedical waste is thoroughly segregated into detailed categories. Autoclaving and the chemical treatment are widely used. Advanced technology like gasifications and plasma are treatment for hazardous waste minimizing emission. Strict monitoring and the data transparency are integral ensuring safety and regulatory compliance. The next country is Germany. Germany follows the waste hierarchy principle, emphasizing prevention, reuse, and recycling before treatment. Most infectious waste is treated using autoclaving, while hazardous waste is incinerated under the stringent emission control. Germany's decentralized waste management system allows local authorities to optimize resources, reducing transportation costs and environmental impact. The next country is Singapore. Singapore employs a highly integrated waste management system. Biomedical waste is incinerated and central facilities with the state-of-art pollution control measure. The city-states enforce strict penalties for non-compliance and leverage digital tracking to ensure efficient collection and treatment. Public-private partnership support cost-effective operation. Now, the best practices in India has made significant strides in biomedical waste management with introduction of biomedical waste management rule of 2016, emphasizing segregation, barcoding and treatment. However, gap remains in infrastructure and enforcement. Poor segregation at source, especially in smaller healthcare facilities, continue to be the challenge. Inadequate treatment facilities in rural areas lead to unsafe disposal practice. Despite regulation, compliance remains inconsistent due to limited training and awareness among the healthcare workers. To align with the global best practices, India needs to expand infrastructure with modern treatment technology, especially in underserved region. Next is related with the strengthening regulatory enforcement through digital monitoring system. Other is related with the promote awareness and the training to improve the segregation and compliance. And the last but not the least is related with to encourage sustainable practice including the waste reduction, recycling, energy recovery. International experience offer valuable lessons highlighting the need for integrated policy framework and technological driven solution for sustainable biomedical waste management in India. Now let us explore what should be the future scenario of biomedical waste management in India by 2024. As India's healthcare sector expands, the volume of biomedical waste continues to rise, demanding urgent improvement in management system. The future of outlook of biomedical waste management by 2024 is characterized by a focus on first is related with the improved infrastructure. To meet the growing demand, the significant investment in infrastructure are expected. Establishing more common biomedical waste treatment plants, particularly in the rural and the unserved region, will be critical. Upgrading existing facilities with a modern treatment technology, including advanced autoclave and incinerators with better emission control system, will ensure environmentally sound disposal. Waste collection system will likely to be expanded, improve access for a smaller healthcare establishment and the remote clinic. The next is related with the technological integration. The integration of digital tracking system and barcoding will enhance transparency and monitoring. By 2024, more states are expected to adopt real-time tracking for biomedical waste movement, improving accountability and compliance. Automated segregation system, improved chemical disinfection technologies, and plasma-based treatment for hazardous waste are likely to be implemented to increase efficiency and sustainability. The next is related with the stricter regulatory enforcement. Strengthening regulatory enforcement will remain a top priority. The Central Pollution Control Board, that is CPCB, and the State Pollution Control Board, that is SPCB, are likely to adopt stricter penalties for non-compliance and increase the frequency of inspection. Better coordination between the regulatory bodies, healthcare facilities, and the treatment plant will ensure compliance with the Biomedical Waste Management Rule 2016. And the future amendments. Simplified compliance tools and mobile application may support smaller healthcare providers in meeting regulatory requirements efficiently. And the last but not the least is related with the linking to the circular economy approach. Promoting a circular economy will be a pivotal in transforming biomedical waste management from the disposal-centric model to a resource recovery-driven system. By 2024, recycling and reprocessing and disinfected plastic, glass, and metals are expected to become more prevalent. Investment in waste-to-energy technology to convert non-recyclable waste into renewable energy, reducing dependency on the landfills and incinerators. The focus on the waste minimization and the source through the better procurement practice, reusable medical equipment, and sustainable material will further reduce biomedical waste generation. Encouraging public-private partnership will bring in a private sector expertise and funding to improve scalability and sustainability of biomedical waste system. So now we expect by 2030 India aims to achieve 100% proper disposal of biomedical waste. This ambitious goal requires a concerned efforts from all stakeholders and significant investment in the infrastructure and technology. So here we end up this presentation, and before we proceed for further, let us review the topic. We started the topic introduction of biomedical waste, the most demanding and the challenging waste management in India, and later quantify biomedical waste types in India. To make the topic interesting, we shared experience of biomedical waste during COVID-19 and further discussed about the evaluation of the biomedical waste rules and guidelines in India, and later explained how color coding system for biomedical waste segregation is helpful. This is followed up with the narration of the treatment technologies for biomedical waste and the role of stakeholders and challenges in the biomedical waste management were clearly discussed. We also covered the economic aspects of biomedical waste management and shared the international best practice comparative with India's position. At the end, we narrated the future outlook of biomedical waste management in India by 2024. Now we shall move to the last topic of waste management series, I appeal the viewers to stay tuned before we dive the last topic of the waste management on constructions and demolition waste from the development sectors in India. Till then, wish you all season greeting with a happy new and a prosperous year.